Welcome, everyone. I am Bob Wurzelbacher, the Director of the Respect Life Office for the Archdiocese of Cincinnati, and this is our video podcast series that we call Being Pro-Life. Each month, we'll discuss a different topic in the Respect Life arena. We'll hear personal stories from people deeply affected by that issue. And finally, we'll share ways that you can get involved. This month's topic is palliative care. Today, we have several guests. Will you please introduce yourselves?
Hi, everyone, and hi, Bob. My name is Denise Hess, and I'm the Executive Director of the Supportive Care Coalition.
My name's Caitlin Vogt. I am a palliative care social worker in Milwaukee, Wisconsin. I work for Aurora Healthcare.
My name is Tim Jessic. I'm a palliative medicine physician in Milwaukee, Wisconsin.
So Denise, let's turn to you. You're the Executive Director of Supportive Care Coalition. Maybe we can start by defining palliative care a little bit for us. What does that refer to?
One of the biggest misunderstandings about palliative care is that it's exactly the same as hospice care, and it's not. Palliative care is available to anyone living with a serious illness, and it doesn't have to be an illness that would eventually take your life. And it provides that type of care focused first and foremost on the person who has the illness, and then attending to everything that might arise in the course of living with a serious illness. So you need a doctor and a nurse because there are physical symptoms that can go along with having a serious illness. There are emotional and relational concerns that arise. And so you need the support of a trained social worker. And of course, there are spiritual concerns that arise. And so you need the assistance often of a trained chaplain who can help you in service of your overall well-being while living with an illness. Another misconception is that palliative care would only be for older people, again, at or nearing the end of life. Unfortunately, kids get sick too. And
Right.
Kids need this kind of care. And again, I can't emphasize enough how the palliative care team is not just there for the person with the illness, whether that's a child or an adult. It's absolutely stressful to be the person who is in the hospital bed, but it's also very, very stressful to be the people caring for that person. And those people also can benefit from the support of a palliative care team.
But it's not just physical pain, it's spiritual pain, it's psychosocial pain, it's having distress from some of the big issues that you're facing when it comes to end of life and death, and sometimes the worry that goes along with it and the stress that goes along with some of the outside stressors of financial burdens or what's going to happen to my house or my family or my loved ones. So we really try to look at a whole person's pain versus just their physical pain. And it's more than just pain. It's quality of life, making sure that their voice is heard and that they're really benefiting as much as they can from the care that they want versus feeling pressure or forced into care that they may not feel is appropriate for them.
So Dr. Jessic, most hospitals probably have some level of palliative care specialist, maybe one, maybe a team, maybe large. It's going to be different depending on the situation. But is it still in today's world most likely that the patient or the patient's family should request palliative care?
Yeah, the hospitals are getting better, but sometimes these well-meaning clinicians don't think of palliative care as an option for a lot of different reasons. So absolutely, this is a place where patients and families can advocate for themselves, saying, hey, we really would appreciate a palliative care consult to help us sort through these really tough discussions and decisions.
So Caitlin, I imagine that the average person is not even aware of the existence, right, of a palliative care team at a hospital. They wouldn't even know to ask. So how active is a typical palliative care team in knowing what patients at that hospital are in a situation where they could really use the help of a palliative care team?
For our system, there's no way for us to keep track of, even for the patients we've seen in the past, if they come back to the hospital, we're not automatically reconsulted to see them. We are really at the mercy of the physicians. The physicians place a consult asking for our involvement. The one time that we can absolutely, without doubt, get involved is if a family or the patient themselves asks for palliative care. So really growing that education that palliative care is a service that's available at a lot of sites is great.
What are the situations under which it would be really appropriate for me to say to the hospital, hey, can I talk to a palliative care specialist?
If a family notices that a patient's declining over time, and is being admitted to the hospital several times, 3 or 4 admissions in 3 or 4 months. That might be a time to sit down and talk about goals. Boy, the heart disease seems to be getting worse. So dad's function is declining. We might need to talk through this from a big picture perspective, or if there's a big decision to be made. Is it time to intubate dad or not? Or should we consider a feeding tube? Or does starting dialysis make sense? And then, of course, as you mentioned, patients and families have been spending 7, 8 days in the ICU. Which way do we go? What makes sense? Not necessarily withdrawing care, but how aggressive should we get? Those critical moments is an ideal time to have palliative care involved too.
Is the need for palliative care on the rise in the United States? Is it just that we're more aware of the need?
Absolutely. The need for palliative care is on the rise given the growing aging population. Because of medical advances, diagnoses that used to be terminal, like let's say emphysema or chronic obstructive pulmonary disease, many cancers, many forms of heart failure. Medical technology has made it so that we can live much longer with diseases like those that used to take our lives fairly quickly in the past. So the need for palliative care is definitely on the rise. Unfortunately, public awareness of palliative care is not on the rise. The most recent data that came out found that through a very large survey of the US population, 71% had never even heard the term palliative care. But multiple studies have also found that physicians often won't bring up palliative care because they're worried that if they do so, their patient will hear, "Oh, you're giving up on me," and they'll lose hope. Again, going back to that myth of palliative care. Palliative care is not about dying, it's about how to live well. So we have a very large public awareness or marketing problem, if you will,
Right.
which is why I'm so grateful that you're doing this podcast. And the reality is right now is many people learn about what palliative care is when you're in an ICU, having to make terribly difficult decisions in a very high stress environment. That is not ideal. And again, speaking from my point of view as someone who's worked in Catholic healthcare, I believe strongly the best place to first learn about palliative care is in your faith community, in your parish. I would love to see the day when parishes are offering adult education classes on what is palliative care, what is advanced care planning. Do those things align with my Catholic faith and beliefs? How do my Catholic faith and beliefs inform how I might approach serious illness if and when that time ever came? I think we have so much opportunity within our faith communities to raise awareness so that people are informed and know to ask for it.
So, Dr. Jessic, let's turn to you. I understand you have a personal story you can share related to palliative care.
My mom had pretty severe dementia, but also really bad blood vessel disease. So she was always having problems with sores and leg pain. So it was really a combination of different problems. But every time she got admitted to the hospital, her primary care doc was good at treating the infection and things like this. But he never was able to really have that conversation with the family about, well, let's look at the big picture. But it got to the point where they suggested surgery for her leg. And my family agreed to going through surgery because they didn't have anything else to do. Well, finally, I got a little bit more involved as a palliative doc, called the surgeon and said, listen, doing this pretty big surgery could cause harm. And he agreed, yes, it could. And it might help the one leg, but it's not going to help all the other problems. He says, no, it's not. So I asked whether or not this was really more of a burden to my mom than a benefit. And he agreed. He says, yeah, I really don't want to do the surgery, but since your family wanted it, I'm offering it. So it wasn't until that discussion were we able to go back to my family saying, I think the surgery is too risky. It's not going to satisfy your goals, Mom. I don't think we should do it. One of my family members suggested a palliative nurse that was in the community to come see my mom. And even though they were only able to take care of my mom for 8 days before she passed, her pain control was much better. Her wounds were really well managed in the home. But more so, the support that they gave my mom and my family was fantastic. So it's a very, very short period of time that palliative was involved, but it made a huge difference.
I can think of a situation where there are several specialists involved. This happened with my father-in-law. We had a heart doctor, he had a kidney doctor, he had all kinds of specialists because there were so many issues going on at the same time. And of course, they were never in the room at the same time. And it was difficult as the loved one who was trying to take care of, really my wife, trying to take care of her father, in understanding what's happening and what's the best decision to be made. And that's another situation where bringing in a palliative care specialist would actually help. What's the best course of action that maybe you can't get talking to each individual doctor one at a time? Is that fair?
Yes, healthcare is so siloed right now. And the old-fashioned Marcus Welby doc that knows the
Right.
patient, knows all the family,
Right.
they're not around anymore. They're not in the hospital. So you have a bunch of well-meaning clinicians that are focused on the heart, and a different doctor focused on the lungs, and a different doctor focused on the kidneys. And they're very, very good at their specialty and with that organ, but who's taking care of the patient? So that's part of the place for palliative care now, and a palliative care team is to really put all that information together, meet a patient and family where they are, and figure out which part of the medical team's suggestions makes most sense for that patient and family based on their goals.
So Denise, what are some ways that palliative care aligns with our Catholic faith?
Palliative care, to me, was invented by Catholic religious long ago, before it was ever recognized as a medical specialty, before hospice existed. Religious orders were taking care of the dying. It's just absolutely in the DNA of who we are then as Catholic healthcare ministries. And then in addition to that, multiple popes have spoken out very much in favor of palliative care. From a very high level point of view, the Catholic faith principles, values, and belief absolutely align with palliative care. And then from a on the ground, it's part and parcel of who they are and who they have always been, companioning the weak, the marginalized, the poor, the sick, and the dying. I can't imagine a much better alignment between palliative care and Catholic faith convictions.
Let's talk a little bit then about physician-assisted suicide. You come from Oregon, where it is actually legal. So we know there are going to be some patients who are receiving or eligible for some palliative care that are also either interested or thinking about physician-assisted suicide. So how do we, in Catholic healthcare anyway, respond to a patient like that? And how is it that good palliative care might even help a person who is thinking about physician-assisted suicide to live as long as they can instead?
Just because I and my colleagues in Catholic healthcare have always worked in a setting where we will never participate in helping someone hasten their death doesn't mean that we don't need to be ready and equipped with an extra measure of compassion for those moments when people will ask us, I've heard there's this law in this state, and if I want to, you can help me end it. When someone asks about that, that says there's some very profound suffering that is coming to the surface. No matter what setting you work in, we all need to take the time to explore where that question is coming from. For many people, that question is coming from a very vast misunderstanding of what the dying process, given their diagnosis, might look like. People have seen things on TV, read horrible stories, heard from family members and friends about terrible suffering at the end of life. And again, the specific form of palliative care that would be provided at the end of life is called hospice. So hospice teams are the gold standard of managing just about any symptom that can come up at the end of life. Often when people hear that, they're comforted and no longer are as interested in pursuing hastening their death through a lethal prescription of medication. That said, I also have to add, though, that there are folks who no amount of explaining, no amount of excellent palliative care, excellent hospice care would dissuade them from wanting this option. And the data bear out that they're usually people of privilege who have experienced throughout their lifetime lots of personal autonomy, lots of personal control, and the thought of being dependent on others as their own physical condition declines is abhorrent to them.
Right.
The data bears out that people are not reporting that they want this because of uncontrolled pain or physical symptoms. It really is a deep existential fear of dependency and loss of control. So again, whether I were to work in a participating or non-participating organization as a chaplain, I would really want to explore that with that person. What is it that they fear about dependency? What is so terrifying about that? And see if there are ways to ease that fear. And think of the disability community and how much these assisted suicide laws feel personally threatening and personally devaluing of their life, because a typical person who utilizes this lethal prescription is in some ways saying, I won't tolerate a life of dependency, of disability, and therefore it's not a life worth living. That is not a statement that we want to send to anyone made in God's image.
So the average person in the pew, right, who listens to this podcast and watches this video, they're like, wow, I've learned so much more about palliative care, what it is, and I want more people to be aware of this. And what can people do to help this issue?
I would direct you to my own organization, the Supportive Care Coalition.
So you can find your organization page at supportivecarecoalition.org, right?
Mm-hmm.
Supportivecarecoalition.org.
Yes. Here's our web page. And I would direct you to click on the About page. And here you can read a bit about what palliative care is. You can watch a video about it. Navigating over to, if you go back up to the top and head over to the Mission and Ethics page. Here, for those of you who really want to learn more about the Catholic views on palliative care, we have links to a lot of the recent offerings that came out of the Pontifical Academy for Life. And if you're really interested in some of these more detailed topics, we didn't get into today this treatment called palliative sedation. There's another document in that big pink box called Physicians' Orders for Life-Sustaining Treatment. In other states, it might be called a MOLS, but it's a traveling medical order that expresses your medical treatment wishes. If you want to learn more about that from a Catholic perspective, we have that resource. If you want to learn more and keep up to date on what's happening on physician-assisted suicide across the country, we recommend that page too. Soon on our website, early in 2020, we will have a series of videos available. They are designed for use in a Catholic parish. They're each about 20-ish minutes long, and they cover a different topic about palliative care. What is palliative care? What is advanced care planning? And we hope that individuals, parish groups, and organizations will use those videos to get the word out about palliative care as a wonderful type of support for someone who has a serious illness.
A couple places to look. One would be getpalliativecare.org. It's a national organization that has a lot of basic information about what palliative care is and isn't, and when may you want to involve palliative care, and what does that look like. I would also love to recommend the American Academy of Hospice and Palliative Medicine site. There is some basic education information and advocacy information for folks to look at as well. I should also let you know that the Pachita Act just went through the House.
Okay, so if you go to AAHPM, it stands for the American Academy of Hospice and Palliative Medicine, AAHPM.org. On that website, a few links down, as you can see here. Pachita is short for Palliative Care and Hospice Education and Training Act.
This would be a big plus for palliative care and palliative care education. Not only would this help educate other docs and nurses about palliative care and basic palliative care principles, this will also provide a lot of information for folks like you and me that just don't know much about this.
You click right there on that link, and it tells you how to email your local senators to try to get your senators to support an expansion of palliative care workforce awareness and research. That's a great little action step.
One other big area that I'm really excited about is through the Archdiocese of Milwaukee. We have just finished producing videos for Catholics, for folks in the pews. Basic information about what advanced directives are and how they're useful, and what's important with the faith as far as ordinary means, extraordinary means, and things like that. Those videos will be available for everybody December 1st of this year. So you and your parish could request not only going through the videos, but maybe implementing this program at your parish. So maybe you can ask your priest, and maybe some healthcare professionals to lead an evening program where you talk about advance directives and about palliative care and about hospice, specifically from Catholic teaching.
So, Caitlin, other suggestions you might have for anyone?
Helping to spread the word about palliative care and dispelling some of the myths that palliative care is the same as hospice care. And if I'm getting palliative care, that means I'm dying soon. I think often when somebody hears the term palliative care, especially with the patients that we work with, sometimes they say, oh, I'm not ready for that yet. I'm not ready to die, and are very closed off to talking with us and really can't get the benefits that we can offer them because they're just not aware that there is a difference between palliative and hospice care. And so we spend a lot of time making sure that they understand that.
Okay, well, thanks to everyone today for talking with us about the importance of palliative care, how more holistic of an issue that is than probably most of us realize, and how in alignment that is with Catholic teaching already and the care for the whole person and their physical needs, their spiritual needs, and even how any of us can get involved in helping to raise awareness and educate people on how important that is for us today.
Thank you so much, Bob, for having me. Thank you for all of those who listened in, and God bless you.
Spread the word about palliative care. It's something that I'm very passionate about, clearly working in this field, and it's great to get out there and let everybody know the benefits of it. So thank you so much for giving me the time to do that today.
Thank you very much, Bob, for this opportunity to talk today. This is such an important topic and issue for our patients and families. I do appreciate you raising the awareness.
And I want to thank all of our viewers and listeners for tuning in on this episode of our Being Pro-Life series. Head to the website to view all the links talked about in this episode at www.catholiccincinnati.org/being-pro-life. Thank you again for joining us today, and I look forward to being with you next time.